Should you take psychiatric medicines? Well, I'm Dr. Paul Looney, and I'm a board certified psychiatrist. I have a love hate relationship with psych meds. This video is about the use and abuse of psychiatric medicines, and if this type of content is valuable for you, please like, comment, and subscribe. So, psychiatric medicines play a crucial role in treating mental health disorders, but they also carry risks of misuse and abuse, side effects, and other problems. But let's take a look at this important topic. Especially if you are a Christian, this video may help you. The Bible has a lot to say about anxiety and fear, joy and happiness, and so it's tempting to think that a good Christian would never suffer mental illness, and if they did, they would not need medication. They could just pray more, seek godly counsel, just guard their thoughts, and do okay. But interestingly, studies at the National Institute of Mental Health several years ago found that in their studies, those with the highest levels of spiritual maturity, while they did better in many parameters of mental health, they were more likely than the general population to suffer an episode of depression or bipolar disorder or mania. This really shocked me, and it really bothered me quite a dismay to find out. But then I began to think about the greats in the Bible and people like Job, who very early on showed us how the most godly man could go through such suffering and grief that he would be tempted to despair, that he would um, find himself struggling with feelings of depression that's so bad that he wished he'd never been born. David, a man after God's own heart, also seemed to have real times of uh, deep despair and some very high highs. Some speculate that he might have had bipolar disorder. Jonah certainly wanted to die after Nineveh came to faith. Elijah, after having a showdown with the prophets of Baal on Mount Carmel and seeing fire come down from heaven, the next day he's just complaining to God that his life is meaningless and asking God to take him. Even John the Baptist had a very dark moment. But all of these people who loved God still had an immense struggle or a moment of breakdown. So it turns out, in my experience, that mental illness can interrupt the flow of our existence and cause us to cry out for help from God and sometimes from others as well. Well, what about medications? What should our attitude be about taking medicines for illness? Well, most people these days do take antibiotics because they're life saving and often take medicines for diabetes or high blood pressure. Um, we don't really have much in Scripture about taking substances to help with mental illness, except for um, Paul's admonition to Timothy. 1 Timothy 5:23, he says, "Stop drinking only water, but use a little wine because your stomach and your frequent ailments." So the implication is that it is at times suitable and advisable to take a substance to help with illness. So, what is the case for medications? When they're used as prescribed, medications, and particularly psychiatric meds, can significantly improve symptoms and the quality of life for many people who suffer. Medication can be the difference between a healthy, satisfying life and crippling disability from illness. In some cases, medication can even be life-saving. My own brother suffered from bipolar disorder and ended his life tragically at age 25. A tragedy that might have been averted by proper medication. So, in their proper use, psychiatric medications work predominantly by altering brain chemistry to help regulate mood and thoughts and behavior. but they're most effective when they're combined with lifestyle changes, with therapy and other treatments. When prescribed at a time after a time of a severe crisis or loss, high anxiety or depressed mood, they can kind of function like a splint does on an on an ankle after an injury. If you sprain your ankle, the tendons can get stretched or torn, the ligaments, and they need support in order to heal properly. When I was a university campus doctor back in the early 80s, I had an athlete resisting the idea of a splint because she wanted to run unencumbered. Of course, I assured her that was my goal, but without the splint, the injury could get worse, could be re injured, and the bones not be properly aligned as the joint was recovering. So the splint um, can sort of symbolically be like a psychiatric medication that can bring brain chemistry back into alignment to allow for proper healing. The medication actually can allow the formation of healthy brain and body habits. In fact, some psychiatric medicines like Prozac and other SSRIs actually encourage the growth of new brain cells, new neurons, which may be part of why they are helpful in recovering from depression and dealing with things like obsessive compulsive disorder. But the medication allows the person to get out of the rut that they're in, so to speak, in their thinking, and form new brain and body habits. And of course, once that happens, the splint can be removed after a time of healing and growth. We know that the pathways in your brains are a little bit like pathways that we cut through the forest. That when we first go through, it's maybe very narrow, but as we travel those pathways of brain thought, that those healthy pathways, our brain does us the favor of surrounding those neurons with myelin, which insulates them and makes the pathway stronger and faster. And the medicines, again, can help that process of healing and growth. Sometimes medicine can give the person the calm, the energy, the motivation to address issues that otherwise would be overwhelming or intractable, especially when old thought patterns are negative or limiting. Then proper medication can, again, promote that new cell formation, allow new and healthier neural pathways to be established. So imagine a woman coming to me who's depressed because she feels trapped in a horrible marriage. In that case, I might suggest medication to help restore her hope, help to elevate her mood, help provide clarity and the courage to address the problems at hand, helping her to consider her possibilities and take action that might promote change within herself and within the marriage. In this case, she's using the medicine to help her engage life fully and responsibly. This is a proper use of medication. By addressing both the current and the past issues with the help of a pastor, a counselor, or a life coach, can help her then decide on her best course of action. Naturally, some people want to take medicine to avoid dealing with their real life problems. They don't really want to do the hard work of transformation or confrontation and dealing with struggles. They just want to get relief, and they want medicine to fix them, to give them just that instant relief. And a lot of people think, oh, well, I just have a chemical imbalance, and so I just need to restore this balance to my brain. That's all I need to do. Just take this pill, everything will be fine. Well, in my view, that turning to psych meds in that way is a form of abusing them. Anytime we use something that's intended for one purpose for another purpose, we're abusing it. It's similar to Adam and Eve in the Garden of Eden. They used the trees, which were good and made for their benefit, to feed them and protect them. They used those very trees to hide from God. And sometimes we can use an otherwise good medication to avoid healthy relationships with ourselves, with our circumstances, even with God and other people. So, as is clear when we think about abusing alcohol and other drugs, turning to psych meds simply for relief of psychological pain is a problem. When I see this done, though, I often see that psychiatric medicines cause other difficulties with side effects or dependency if they're being seen as an end in themselves. Um, in the case of the woman with the bad marriage, if a person is taking a medicine and not addressing the life problems, then those same problems will likely cause a failure of the medication over time. It's a sort of a temporary boost to deal with problems. But even in the best circumstances, a failure of medication could be a gift that God is inviting us to drill deeper, to address unresolved problems from the past or in the present. And let's face it, a lot of us need a crisis to make us desperate. We need at times to wrestle with God in order to grow. And certainly we don't want to assist people in avoiding the best resolution to a problem by putting a band-aid on it. So for many, medication is a short-term gain or benefit. Um, some people will need, in my opinion, long-term maintenance medication for the duration of life for certain illnesses. For example, bipolar disorder, or what we used to call manic depressive disorder, schizophrenia. Certain people have had recurring bouts of major depression, obsessive compulsive disorder, some severe anxiety disorders, and some people with ADHD will do better with maintenance medication. But in these cases, often the doses for maintenance are quite small. The old saying is that an ounce of prevention is worth a pound of cure. So it's better very often to stay on a little bit of medicine so you don't have a recurrence rather than to wait and then, try to catch back up again. But like other chronic illnesses like diabetes or high blood pressure, elevated cholesterol, the best outcomes with psychiatric illness often come with a combination of medication plus some significant lifestyle changes. Healthy lifestyle choices can help decrease the need for meds, and exercise in particular is a huge factor in many mental illnesses in helping to reduce anxiety and elevate mood, to minimize the dysfunction that can occur with mental illness. So once again, the medicine can provide the temporary relief and the boost to facilitate changes that need to occur. It's a little assist, a temporary grace period to provide us with calm and courage to act on the knowledge that we receive in order to change our ways. That said, if the person doesn't ride the wave or use that energy boost they get from medicines to get moving, to exercise, to address issues, the benefit will likely not last, and we can sink back into that lethargy or depression or paralyzing anxiety. So if you're a sufferer, don't let this happen to you. The medicine is not your solution. It can only assist you in taking responsibility for your life, your mood, your happiness, your productivity, and your relationships. Medicine can give you a leg up, but you have to ride the horse. At the end of the day, our confidence is in God, not in medicines. If you're suffering, consider a trial of medication, but you need to have faith that it is God's provision for you. Paul says very clearly in Romans 14, verse 23, whatever is not of faith is sin. And so I don't want you to put anything into your body that you can't receive as God's gracious provision for you. And of course, a lot of us put things in our body, probably not the best thing for us. It often is funny to me when I'm working with somebody who may be a believer and they're turning to food or alcohol to medicate their pain, but they're very resistant to taking medication. I'm like, okay, you're turning to alcohol or other substances, sometimes pot, but you don't want to take medicine. It really is seems comical and a little baffling to me. But um, if you are considering psychiatric medication, you think that it might be a help for you, simply pray that God will either make it hugely effective without any significant side effects, or if that's not the best thing for you, that He will allow that to become clear. Jesus reminds us that if we ask for a fish, our Father won't give us a snake. If we ask for bread, He won't give us a stone. And so when you ask God for His help, just trust Him that He'll make it clear. If you're operating in good faith and just thinking of it kind of like an experiment, like let's knock on this door. Jesus says if you ask, if you seek, if you knock, you'll receive. And so medication is just knocking on another door to help you find the healing and the help that you need. And for some people, it is remarkably helpful. Now, obviously, this little video does not address the more glaring instances of medication abuse. Some people obviously are abusing it in much more rampant way. But if you'd like a video about that, please indicate in the comments. If you have any questions or comments, please put them in the comments section below. I don't always see them, but I will try to respond when I do. I hope you found this little video helpful. Again, please like, comment, subscribe, share. I love you.